South Bend is not a very big city, but we're having about 100 deaths from drug overdoses every year. So that's one every 3 to 4 days. And almost all of those deaths are due to high-potency opioids, typically fentanyl. So you can see there's like some Xanax bars there and some M30s. Those are the ones that are most likely to have high-potency opioids.
And the city of South Bend has an overdose rate that is more than double the national average. That's where we are. When we talking about rates slightly coming down in the state of Indiana and other locations, we're not seeing that here.
Something I've really been touched by is that people that I meet, often they'll tell me stories about loved ones that they've lost, friends they've lost to a drug overdose.
We have to constantly let people know what is in their drug supply, because our treatment providers, our hospitals, our medical doctors don't know what's in the drug supply. That is changing that rapidly. And so the only way we can help them, if someone comes into treatment and their provider doesn't know what they're using, then they can't help them.
The caregivers need to know what's in the drug supply. And one of the ways caregivers and people who use drugs can find that out is with these test strips. And then the line at the bottom is often a faint line. As long as you can see any line at all, that means that there is no fentanyl.
Test strips basically are the tool that help the people to stay alive, because they will get that feedback and know and understand what drugs are in the community, in addition to the drugs that they're using, like opiates, like methamphetamines. So the test strips are to inform and educate people, and to let us know as a community what kind of substances are out there, and what is a person thinking that they're getting, and what are they really getting.
People are really wrestling with these demons. I think it is a part of how we respond to people who are in that kind of trouble. Do we treat them as unhuman, not worthy of love or care? Yeah.
Drug checking is critical for the people who use drugs, but it's also critical so that we can begin to help them get to a more healthy place.
For me, part of the importance of working with the community on this is that the community is a source of strength. And so we give what we can, and I'm an analytical chemist, so this is what I can do.